Dengue fever. Objectives. At the end of this assignment, students will be able to cognitive. Introduce and define dengue fever. Discuss etiology and types of dengue fever. Explain pathophysiology and clinical manifestations of dengue fever. Psychomotor. To provide holistic care of dengue fever. Effective. Evaluate patients' response to the care. Introduction. Dengue fever. Dengue fever is viral disease that is spread by mosquitoes. Dengue viruses are transmitted to human through bites of infective female Aedes aegypti mosquitoes. Definition. A debilitating viral disease of the tropics transmitted by mosquitoes, and causing sudden fever and acute pain in the joints. It is also known as breakbone fever. Types of dengue fever. Dengue fever can develop into more severe forms of the illness, which are following. Dengue hemorrhagic fever. Dengue shock syndrome. Causes of dengue fever. Dengue fever is caused by infection with one of 4 different viruses known as A. aegypti, A. albopictus, A. polynesiensis, A. scutellaris. Incubation period. 2 to 7 days, minimum, 3 days, maximum, 10 days. Mode of transmission. Humans are the primary host of the virus, but it also circulates in non-humans. A female mosquito that takes a blood meal from a person infected with dengue fever, during the initial 2 to 10-day febrile period, becomes itself infected with the virus in the lining its gut. About 8 to 10 days later, the virus spreads to other tissues including the mosquito's salivary glands and is subsequently released into its saliva. Infected female mosquitoes may also transmit the virus to their offspring by transovarial, via the egg, transmission. Pathophysiology. Dengue virus is transmitted to human through the bites of infective female Aedes aegypti mosquitoes. They typically bite during the day, particularly in the early morning and in the evening. Clinical manifestations. Dengue fever : skin rash that appears about 4 days after the onset of fever. Metallic taste in the mouth. Appetite loss. Nausea and vomiting. High-grade fever. Severe headache. Pain behind the eye. Joint and muscle pain. Appetite loss. Abdominal pain. Diarrhea. Dengue hemorrhagic fever. Bleeding under the skin. Bleeding from the nose and gums. Low white blood cell count. Low platelet count. Dengue shock syndrome. Severe bleeding. Tachycardia. Hypotension. Mental confusion. Diagnosis for dengue fever. Early diagnosis is important to reduce the risk of complications. First of all, physical examination helps to diagnose disease. CBC, complete blood count. Viral antibodies, 1 gg and 1 gm, testing for infection. Management. Medical management. There are no specific antiviral drugs for treatment of dengue fever. However, maintenance of the circulating fluid volume is the central feature of DNF management. With appropriate intensive supportive therapy, mortality may be reduced to less than 1%. Plasma volume expanders. Nursing management. Keep the client at bed rest and ensure safety to prevent from injury. Early monitoring: nothing for narrowing pulse pressure, sudden drop in temperature, decreased blood pressure and pulse rate, and other signs of deterioration. Strict monitoring of fluid intake and output. Encourage to drink 1,500 to 2,000 milliliters/day. Explain to the patient and family signs of bleeding, and immediately report if bleeding occurs. Keep patient at rest during bleeding episodes. Maintain O2 saturation if needed. Control bleeding. Monitor patient's general condition. Monitor platelet count every day. Give and maintain oral hygiene. Give cold compress of tap water. Increased appetite and input per oral. Complications. Heart problems. Liver problems, liver enlargement. Death. joint problems, damage to the lymphatic system, circulatory system failure. Prevention. Use of mosquito repellent creams, liquids, coil, mats etc. Wearing full sleeve shirts and full parts with socks. Use bed nets for sleeping during day and night time to prevent mosquito bite. Use of larvivorous fishes in ornamental tanks, fountains, etc. Use of chemical larvicides like a bait in big breeding containers. Aerosol space spray during daytime. Detection and elimination of mosquito breeding source. Management of rooftops, porticos and sunshades. Proper covering of stored water. Observation of weekly dry day. Sensitizing and involving the community for detection of AEDs breeding places and their elimination. Avoid outdoor activity, particularly around dusk and dawn when mosquitoes are most active. Stay in air-conditioned accommodation with fly screens on the windows. Discharge plan. Encourage nutritious foods like vegetables, meat and fruits. Instruct the family members to give the client protein, Vit K, Vit C and carbohydrates-rich foods. Take the prescribed medicine having a written reminder of the correct medicine time to take. Don't use aspirin, it increase the risk of bleeding. Increase oral fluid intake. Instruct to avoid excessive activities that may result to stress. Advise hygiene and to maintain cleanliness on surrounding. Dengue prevention plan. Discuss the possible source of infection of the disease. Educate the family/patient on how to eliminate those vectors. Never stocked water in a container without cover. Gallon, container and tires must have proper way of disposal. You use insecticides at home to kill or reduce mosquito. Encourage the family of the patient to clean the surroundings to destroy the breeding places of mosquito. Summary. Dengue is a mosquito-borne viral infection. The Aedes aegypti mosquito is the primary vector of dengue. The virus is transmitted to human through the bites of infected female mosquitoes. After virus incubation for 4–10 days, an infected mosquito is capable of transmitting the virus for the rest of its life. Dengue fever is a severe, flu-like illness that infants and adults. There is no specific treatment of dengue fever. There is no vaccine to protect against dengue fever. Reference. Parvez Akbar Khan, 2013. Basis of Pediatrics. 8th edition. Pakistan. P.K. Panwan, Medical Surgical Nursing. India. www.google.com